Hello, and thank you for joining me today on Pensar Medical's video channel. The WoundPro Plus is the newest member of our family. We are proud to offer a complete continuum of care. When they developed the WoundPro Plus, they made sure that its smaller footprint could still handle what the wound throws at it, and it absolutely does. It's perfect for your patients that are more active and appreciate the portability, and it is ideal for acute care, rehabs, and skilled nursing facilities and home care. We have kept the user interface the same on the WoundPro and the WoundPro Plus for simplicity. Our pumps have bold, large buttons for ease of use in low light. At just 2 pounds, it is still packed with its big brother's features. One of those features that clinicians appreciate is that it has one of the most powerful pumps in the market. At 9 liters per minute, it is able to treat large wounds. The WoundPro Plus offers all 3 therapies: continuous, intermittent, and variable intermittent. It has a 300cc canister and all the safety alarms: vacuum leak alarm, line block alarm, canister full alarm, and low battery alarm. To turn the WoundPro Plus on, press and hold the green button until the screen illuminates. After a quick diagnostic check, the unit will be in the standby mode. You will know that you are in standby because the operating circle in the center will not be moving, and it will say standby in a blue highlighted bar in the top left corner of the screen. The standby mode comes up first, which gives the nurse the opportunity to check the settings before starting the therapy. In the top right corner, you will see the pressure setting that was last used. Here it is -125 millimeters mercury. On the left, it shows if the pump is in continuous or intermittent mode. If that is the therapy that is ordered, then you can press the power button again to begin therapy. Changing the settings on the WoundPro Plus. Let's learn how to get into the menu part of the pump. Just remember that in order to get into the menu, you must be in the standby mode. If you are in the run mode, you would need to switch to standby by pressing the power button. The operating circle will stop rotating, and in the upper left-hand corner, it says standby. Once in standby mode, you will press the green power button, then press and hold the blue button and release at the same time. You will begin seeing continuous or intermittent blinking. That is the mode you are in. So in this case, we are in continuous mode. You can use the arrows to toggle back and forth between the two. If we now want to choose continuous mode, power on. Now we have actually locked in at -125. By hitting again, we're now in run mode. Now our system is operating at continuous -125 millimeters of mercury. To stop therapy and turn off, you can hold and stop. Intermittent mode is usually a pressure setting determined by the physician that goes from something like -125 or -100 to 0. Variable intermittent will give you a little bit more flexibility, and you're able to customize, which we will be doing now as we set the system into an intermittent mode. For a variable intermittent mode, we're going to need to get into the menu and hit the green button, blue button, and lift off. You'll see that the continuous is blinking at -125, which we're in. We're going to use our arrow to toggle down to intermittent therapy, and we're going to select intermittent therapy. Now you'll see that we have a low pressure setting and a high pressure setting, and also 2 different times. So on this, we're able to change the 80 to 100 if we want. And as soon as we get to what the physician has ordered, we're just going to press menu and select. We can leave it at 20 minutes at 100. We can select that again. And our high pressure setting will be -125. If that's okay, we can press menu again to select, and we'll leave that on for 10 minutes since that is our order. Again, we're going to select that. And now the only thing we have to do is, once it's all set, it gives us the opportunity to double check our settings are correct. And now we're going to lock it in by pressing the green button. The good thing is it goes into the standby mode, again giving the nurse the opportunity to double check her settings. If it is determined that this is okay by the nurse, she is now able to press the green button again and send us into a run mode. And now the patient is receiving variable intermittent
negative pressure wound therapy. If we want to pause, we can just hit the green button and our system is now paused. We can make determinations and to turn off. We're going to press and hold the green button for about 3 seconds and the system will turn off.
Thank you for joining me today. Like us and keep on healing wounds.